Welcome back, everybody, to another webinar hosted from Princeton, available for everybody, everywhere. We're very happy to have Emily Oster with us. Hi, Emily. Emily will talk about COVID-19 school dashboard. She organized a dashboard and will talk about the reopening of schools. What's the evidence? So we're very excited to learn more about that. There's a lot of heterogeneity across countries and states, and that's great for empirical research and to learn more as we go along. So before we start, I would like to talk about the poll results. And you were asked, whether school reopenings in the US is correlated with the COVID-19 rates. Is it yes, no, or if there's no correlation? So if the positive correlation is positively correlated, that's about 40% asked said this. Is it negatively correlated? About 20%. And it's not correlated, that's about 40% as well. The second question was, which country has the most problematic school opening? And it's between France, Germany, Israel, and the UK. And the answers are 25, 5, 41, and 29%. I don't have a good answer for that because I don't know all the policies, so I wouldn't have known. And the third question is, should schools open with an area level positivity rate of 5%? Yes or no? And the answer is roughly split. So it's about 50-50. So let me make one slide, two little remarks before we give the floor to Emily. I want to come back to one point, to one paper Ramanan Lakshmararyan made or gave. It came recently out in Science. He was an earlier speaker in our webinar series, as you probably remember from April, where he was really talking about the Indian situation. And he's studying both economics and epidemiology. And he has done a study in South India with more than 500,000 people, and there were 85,000 COVID-infected people. And what they find is that the children and the young adults have a very, very important role to play in transmitting the virus. And it's particularly within their own households. That's something interesting to know. Of course, it's particular to India. India has a much larger young population compared to the US or the other Western countries. And they also live in much larger households. So it's many generations living in the same building or under the same roof. The other thing I would like to raise, and perhaps we can touch on this, it seems like in different countries you have the same virus, but you have very different policies, not only with regard to schooling, but many other aspects. And one thing which strikes me very much is in Germany, for example, airing the rooms, the lecture halls and classrooms is very, very important. It's very, very highly recommended as a major aspect of keeping the virus down, to make sure that the aerosols are not flowing from one child to the next, is that every 30 minutes, there will be a 10-minute session where the windows are opened and new fresh air is coming in. While in the US, you don't hear about airing the rooms at all, the classrooms at all. And I'm curious to learn, perhaps somebody knows, why there's such a different attitude towards airing the rooms, the classrooms in class, or in general, airing rooms at home as well. So with these two little thoughts, I would like to pass on the floor to Emily, and she will tell us more about her data collection efforts and how this will help us to understand better what schools should do. Should they open up? To what extent they should open up? And when do they have to close again if there's some cases? Or what should they handle the way it is, and how do they handle it at the moment? Thanks a lot, Emily. So we're looking forward to your presentation, and the floor is yours.
Okay, so thank you so much, and thank you everybody for coming. So what I want to do today is I want to mostly talk about schools. I want to set the stage a little bit and tell you kind of what was the genesis of this project, and what do I think we are kind of learning from it, and what do I think we know before, and what do I think we know now. Maybe I'll touch a little bit on what Markus was just talking about. But just, I'm going to share my screen and show you some slides. And I want to start by saying, so I'm Emily. I'm a professor of economics at Brown. And my work is actually not on schools. So Markus and I were saying in advance of this that he was saying, oh, I don't know that much about schools, and I don't know that much about schools either. And so I'm not an education economist, most of my work is on health, and actually a lot of my recent work is on statistical methods. And I've been reflecting on that. I'm reflecting on that a lot as I work on this project, because one of the things you'll see that sort of comes out here is that our data, other data, all the data is really incomplete, and in a lot of cases it's sort of selected in a way that, as a kind of economist, I find problematic. And as someone who has written papers about how we're supposed to deal with selection in our samples, or selection in our treatment, there's a sort of feeling of like somehow the data we're getting here is not as complete as we want. And yet at the same time, in this era, we kind of have to be making these choices with data that is imperfect, and sort of piecing together kind of what is the what are we gonna do. And the reason we have to make those choices now, I think, is encapsulated in this first slide here. So when we start talking about schools, I think we have been very, very focused on talking about what are the COVID risks and the COVID risks in schools, and that's super important. We want to be careful about public health, but it is also important to remember why we have in-person schooling and the benefits of in-person schooling. So this is a graph from the kind of this is actually a graph from John Friedman and Raj Chetty from the kind of like first part of the pandemic. And so I know you guys had them. I know, Marcus, you had Raj on to come talk about their stuff. And so this is one of the pieces of information that they collected. So Zearn is an online math program where people complete badges. One of the features of it is you can see in really granular time how much progress kids are making, because they are supposed to do these badges every day. So this is data from districts that were using Zearn before the pandemic, and then the question is, what happened to the badges that people were earning, and you see them declining very rapidly, and that these declines are very large, much larger in middle and low income school districts. So this is one piece of, I think, an increasingly large amount of data that remote learning is not as effective for kids as in-person learning, particularly for lower income kids with fewer resources. When they've been looking at, even in the fall when this was a bit better, the literacy effects in DC, for example, which I think is where we have the best data, are really disturbing. So I think there are good reasons that we want to have kids back in school if we can do it safely. So early in the pandemic, I was writing a lot about the risks to kids and COVID. So I think it's probably worth sort of starting this conversation by saying something about what I think we know about those risks. So the first thing that I think we all kind of everybody is sort of agreed on is that the COVID risks to kids are low. So the health risks of COVID to children are lower than other groups. It doesn't mean that they can't get COVID. They definitely get it. It doesn't mean that they can't spread it. It doesn't mean they can't get very sick, but they are much less likely to get very sick than older adults. They are much less likely to become infected than older adults. This is true sort of even more so for younger kids than older kids. Kind of as you age, the chance of infection and the severity of infection seems to go up. So that's something we sort of generally accept. That it seems to be generally accepted. It's actually not totally clear why that would be true, because generally with coronaviruses, kids tend to get sick a lot. That's why your kid gives you a cold all the time. But with this coronavirus, that is the pattern. So that's sort of good. That's encouraging. A second question that people want to ask about schools is, how much do kids transmit the virus? So perhaps particularly because they tend to be asymptomatic, are they significant virus transmitters? There, I think the evidence is less agreed upon. So we definitely have some evidence, for example, from South Korea, suggesting that kids transmit less in the household than others. The data on India suggested that kids, that was the data you mentioned, Marcus, shows that kids transmitting to other kids in the household, although actually they're sort of less likely to transmit to older people in the household. A study just came out from the UK covering, as far as I can tell, more or less everybody in the UK, which showed that living with the kids does not increase your risk of COVID over the sort of course of, so if you're in a household with children, if you're an older person, doesn't mean you're more likely to have COVID over the course of the pandemic. Different ways to interpret that. Then on the flip side, we have some data on viral loads. I mean, if you dig into this literature, there are so many different pieces of it that one has to put together. So there'll be a study of 56 symptomatic kids with high, in Chicago, where the viral load in kids is high. Then you dig a little bit into it, you say, oh, actually, that's not infectious virus load. That's some of that could or could not be infectious virus load. We don't really know. So the data on this is the data on transmission is kind of mixed. A lot of people want to sort of put those two things together and use those as the main criteria for opening schools. The question of like, how much do kids get sick and how much do they transmit, and to sort of argue that those are kind of the big pieces of how we should make this decision. I think what that misses, other than sort of missing the cost of not reopening, what that misses is actually the people who are at risk from school reopens are not kids. That's kind of the first piece. They're adults. And the thing they are at risk of probably is mostly getting it from other adults. So the kind of like, what are we most afraid of when you open schools? When you open an elementary school, what should we be most afraid of? We should be most afraid of the adults who get together in the break room and take off their masks to have a cup of coffee and lower their guard. That is where you get COVID. That is going to be the most significant COVID spread. That's true, like ex ante, that's sort of what we should expect, and it seems to be true ex post. So one state sent me a bunch of sort of data on their outbreaks the other day, and they like 60% of the outbreaks they're seeing in sort of school settings, outbreaks means more than one case, are staff to staff and appear to be driven by break room interactions. So those are, that's the kind of stuff where we want to, I think that it is very challenging to draw conclusions about whether we should reopen schools from basic science, like how much do kids get it and how much do they transmit it, because a school is not just a bunch of like Lord of the Flies kids interacting with each other with nothing around them. It's a whole infrastructure with kids and parents and teachers and people, and adding on top of that is a question of what kind of masks should we wear and kind of distancing and so on. So this is an important policy question, and I had been working a lot early on in the pandemic on childcare, and so trying to, because in addition to being an economist, I also write books for parents. I have a newsletter, and I was writing my newsletter about childcare for parents, and I actually ended up collecting a little bit of data on childcare and COVID in childcare centers, sort of facing up to the like lack of data that was available from public sources. I had I had a Google Forms. This is an example of the kind of research I've been achieving in the pandemic. This is a Google form on tracking kids and COVID, where I asked people to fill in, whether they had any COVID cases in their childcare center. And then I put out some other Google Forms. This is actually a Google Sheet where I had like lists of childcare centers and looking at infection rates in kids. This is sort of harkens back to my saying at the beginning that I find there was a lot of challenge here because, of course, like the kinds of people who are reporting into my childcare center database are really different than maybe the sort of average childcare center in the country. And so I sort of grappled a lot with questions of selection and the question of, what can we learn? What do we learn from data like this? But at the time that I was putting this out, early in the summer, there basically wasn't a lot of other data on this. And so, there was there's a tension in these places where, people really have to make a decision about their kids, while at the same time, the data is kind of imperfect. This has turned out actually, so it turns out on the particular question of childcare centers, and then I'm going to get into what we do about schools. And the particular question of childcare centers, actually now we do have some pretty good peer-reviewed evidence on kind of risks associated with childcare. So this is from a paper by Walter Gilliam, who did a big study of childcare workers, comparing childcare workers who were at work early in the pandemic, who continued to serve kids, versus those who did not. And he basically finds that there is no additional risk of being in person or not working for this demographic, which I think people, again, sort of gets to the question of risks to staff. All right, so now, so sort of as we entered the end of the summer, there was no data on schools. And so the sort of big project I want to talk about is a project that we kind of are trying to start up to collect data on COVID rates in schools. So I want to sort of talk to I'm going to tell you about, show you the dashboard. I'll tell you about the dashboard, but I want to start with the question of like, what would be the ideal? So what actually should have happened in the US to collect the kind of data that we want on COVID in schools? And I think what we would have wanted to do was have a national data collection system in which schools reported in information on whether they had students in person, how many students they had in person, how many staff they had in person, and then maybe ideally some information about kind of what kind of crazy A, B, C, X hybrid situation they were working on. They reported out some information on what kind of precautions they were taking: masks, distancing, opening the windows, airing things out for 15 minutes. It's not a very large amount of information, but like a little bit of information from like that from schools. And then we would have wanted to track over time how many COVID cases there were in schools. That could have happened at the national level. It could have happened at the state level. It should have happened in June. We should have started setting that up in June. So then in August, when schools started to open, we would have had more information. And there are places that did that. So for example, the UK had some schools open in the early part of the summer, and then they reported out on the risks associated with schools later in the summer before they reopened schools. And what they found was basically schools are very low risk. The UK schools have been very low risk. The answer to that question about where has school reopening been poor is Israel, which is an interesting question, which we can talk about. So that's what the US should have done. But instead they didn't do that. They didn't do anything. And so then we sort of got to August and schools started to open. And now there were a bunch of schools opening largely in very high prevalence areas. So if you looked out at like what were the first school reopenings, it was like Georgia and Indiana. And Georgia started opening its schools. They opened them full time, in person, very little distancing, no mandatory masks. They opened the high schools. They did all of the things that like the sort of public health space would say is not a good idea. Positivity rate was about 15%. They opened the schools. And this is an opportunity, like you could say this is a mistake public health wise, but it was also an opportunity to learn. Because if you wanted to know, hey, is it safe to open the kindergarten in a place with a 2% positivity rate? There at least is a bound provided by what happens when I open a high school in a place with a 15% positivity rate and no precautions. But we didn't have any systems set up to collect that. And so all of the information that was coming in about this was, you know, the media report here, this place opened safely, this place didn't open safely, there were 6 cases here, they quarantined 53 people. In this place, we haven't seen any. People are posting on Facebook, my kid's school is fine, masks are for losers. You know, just things that were not, that even like I, a person who apparently am capable of calling things that are in a Google form data, even I would not find to be acceptable data things. So I got together with a team where basically our goal was to try to do some version of what we thought should be happening in a more kind of national level. And so what we did is we basically tried to collect all that kind of data that I was suggesting, except we did it in a crowdsourced way. So we went, so this is the group doing this is, you know, I have a role in it, but then there's a technology firm called Qualtrics, and there's the School Superintendents Association and the School Principals Associations. And so we went out basically like sort of pushed out to schools a request to participate. We pushed out to schools, we pushed out to districts. We said, hey, sign up your school, sign up your district. We'll ask you this baseline data. We'll ask you this biweekly COVID data, and then we're going to post it pretty much as soon as we get it on the internet. We're not going to identify you. That was like a big thing here, was we're not going to identify you. This is not like COVID shaming, but so because we wanted people to be willing to tell us the truth. But we'll post some information on the internet to try to get a sense of just like what are the kind of rates that we're seeing in schools. How are we seeing? What are we? You know, what is going on?
So Emily, can I ask?
Yeah.
There's some questions about what's about other countries? You know, they also have some school openings. Did they collect the data? Like in Germany, the schools opened with social distancing and all this. So in UK, in France, all over Europe, or in other countries?
Yeah. So the UK, probably has, I think, probably has the best data on this, because they did they did a sort of big systematic study which basically showed very limited school associated cases over the couple of months they were open. Germany and France, I think, have collected some, but I think not sort of put out this data. My general sense from there is that those have been pretty successful openings, that we haven't seen a lot of cases that sort of seem to originate in schools. The place where this has been more problematic, we've seen more report outs of kind of large clusters associated with schools, is Israel, where particularly early on when they opened, there were some very large outbreaks associated with like a couple of high schools there. So,
and you will get back to this, why it didn't work in Israel? What did I do wrong? Or?
I mean, we can talk about it. I think it's very unclear, because it's hard, without systematic evidence, it's hard to understand. Like, so for example, when they first opened schools, they allowed a lot of other things at the same time. This is an issue with evaluating all of the school reopening stuff. So they also allowed like 300-person weddings. And the particular episodes, and then there was a heat wave. And so people stopped wearing masks because it was too hot. And they also didn't do any distancing in the classrooms. So basically there was like an episode in a gym where somebody spread it, like where they basically had to quarantine like a whole high school because somebody, like some people had it at a gym, in a gymnasium, and it was like very hot and nobody had a mask on. And so I don't, so without seeing more, it's a little hard to tell what, they've clearly had a somewhat different experience with this, but it's hard to tell how much they're doing things differently and how much is some other factor.
So, but in your database, which you now collected, did some lessons from other countries enter in your design questions, or you started from scratch and said, let me just do what's best for the US?
So we started, so sort of much of what we're collecting is just information on like number of kids in the classrooms. That's not going to be, in terms of the kind of what precautions did you take, we have maybe 10 or 12 questions on there. And the idea, and we tried to use them, we asked them based on conversations with people who were talking to schools about their reopenings, or based on conversations with schools about what they were doing. So for example, in Germany, they've done a lot of routine testing. We thought about asking, are you doing routine testing? Nobody was doing routine testing. The school superintendents were like, what are you talking about? Like, I don't have any tests. Like, I can't even get the people tested who have COVID. And so we didn't add that in. So we have a question about staff testing at the beginning, where like maybe 7% of our schools say that they do any staff testing at all. So we mostly focused on questions where we thought there would be sort of more variation in the US. Okay, so let me just show you the dashboard. Let me see, wait, I'm gonna stop my sharing, then I'm gonna restart my sharing, because I'm still, despite everything, actually a terrible Zoomer. Okay. I think 8 months in. Okay, so this is the dashboard. The dashboard is built in Qualtrics. And so I've only recently learned that you can change the colors, but there are some things where, like as a data person, I'm appalled. So for example, it's actually impossible to change the axes so they will go above the highest number. But the information is all here. So what we're showing you here, so the data is collected in biweekly waves, and it is not a fixed sample. So we're kind of updating as we get more information and more schools enroll over time. And so there was a wave of sort of early, mid, and then the latest wave is the kind of middle 2 weeks of October, and then there'll be another one that we collect next week about the sort of weeks after that. And so we're reporting this data out in kind of two ways for two groups. So the first thing is we're reporting out for students. And we're reporting it first as just a % of students with confirmed cases over that 2-week period. So the denominator here is the number of the average in-person attendance per day. Average in-person attendance, over that period. And the numerator is the number of cases over that period. So for example, in our schools over the last, over this most recent period, this number says there was an average about 0.9 infections per 1,000 kids per the 2 weeks. Okay, so that's how you read that.
How many kids do you cover roughly to get an idea?
So yeah, sorry, at the bottom, sorry, if you I scroll down, you can see the population. So, so in this most recent period, there's about 1.6 million kids in-person attendance and about 3.2 total enrolled kids. So we're collecting data on places that are remote also, and also even if the places that are in person, not everybody is in person.
Okay.
We also convert this, so these are the same numbers, but we convert these to these daily case rates. So this is sort of, if you spend a lot of time thinking about COVID, this is like the number that you would think about this in, which is just like the daily rate per 100,000. So the daily rate per 100,000 students in this most recent period is 6, okay? But I think useful is to look at that compared to the community rate. So this is the daily case rate for the sort of matched communities. It's a bit higher than the student rate. We have the same thing over here for staff. And the staff, there's sort of like one bump up here. The staff is in general kind of similar, but a bit higher than the community rate, although not like out of the range of the community rate in these locations. And then we're reporting out some information on, say, like mitigation. So almost everybody in this sample has masks, has staff and students masking. And a large share of them have things set up such that students keep at least a 3-foot distance. Then we see more variation in things like increased ventilation, fixed cohorts, group sizes, having classes outdoors, more distancing. Very few places say that they're doing this kind of testing.
Where you can exploit your data. So many teachers are very concerned that they might fall sick and be infected by some students. Is there a way to figure out whether the infection goes from the students to the teachers or more from the teachers to the students? It seems like the teachers have a higher infection rate than the students.
Right. So an interesting, so I think this is the big question, is kind of who is infecting who. But I think to understand that, you need to actually think about whether these infections are happening at school. So the sort of premise of your question was, is this infection happening at school? But actually, for the most part, we it's not obvious that that is what's going on. And so one way to see that, let me actually come back to that, and let me come back to that question in a minute. I want to sort of show one more thing in the dashboard, then I'm going to show some analysis. So, so one of the things you can do with it, there's sort of like a couple of things. There's some filtering, and I think the most interesting filters are by age group. So, so you sort of see in the students, these numbers are kind of like 6 and 14. We can exclude schools that have high school in them, and those numbers drop to 4 and 12. So actually, excluding the schools with high school changes the student rate quite a lot, because younger kids are much less high risk than older kids. It doesn't actually change the staff rate that much. And one interpretation of that is that staff are getting it from each other. Another interpretation of that is they're not getting it from each other at all. They're just getting it outside, and they're just, it doesn't matter who you're around school with. We can also do things like filter into like places that are in person at lower capacity versus full capacity or remote. That doesn't end up mattering too much. And then the last thing I'll show, and then I'm going to talk about what determines these things, is we can filter, say, to just like district public schools versus everybody else. So one of the things to note about the data is that that you can sort of see in these pictures in terms of counts that there was a huge increase in data between wave 3 and wave 4. And the reason for that is that we added basically the entire state of New York. So the kind of main criticism, I think, of this, maybe many criticisms, but a main criticism of this data collection approach, this kind of like survey, like asking people to participate, opt-in approach, is that you miss the sort of consistent, like you only get people who want to report, and that self-selection is going to be towards people who say are better resourced, or people, school districts that are better resourced. That's certainly true, more suburban school districts and so on. So that was our concern. And then we realized at some point that New York was actually collecting all of that New York was actually reporting out at least most of the information we needed, in particular the in-person counts and the case counts for every one of their schools. So in the most recent wave, we added all of the New York schools. So one of the things that lets us do is both be sort of more consistent over time, to have more data. But it also lets us look at, can you see my slides now, Marcus?
Yes.
So it also lets us look at a little bit more detail at some of these things I was saying about community rates, and also at kind of the distribution. So I want to show sort of two things from that. So first, these are some graphs of the community case rate and the student and staff case rate. So these are basically bin scatters. So I've binned the case rates by group, and then I've the dark lines are 45-degree line, and the dots are the case rates, the sort of average case rates in that bin for in per 10,000 in students and staff. So this is school staff, which is in yellow, and high school students, which is in school staff is in orange, and high school students are in yellow. And what you can see is these are basically on the 45-degree. So this is basically what if your community case rate is 10 per 100,000, then you should expect your staff and high school students to have about 10 per 100,000. If your community case rate is 32 per 100,000, it should be 32 per 100,000. The elementary and middle school case rates are lower. They're typically below the 45-degree line, basically reflecting the fact that kids are less risky, kids are at less risk than adults.
But would you say that's an age effect? Or
it's
is
an age effect, yeah. Yeah, it's basically, I mean, I think it was certainly, this is not possible to tell from these data. However, this would be very consistent with generally the fact that kids are less likely to be infected.
There's another question by Bill Kessler. He would like to know, among high schools, can you differentiate between physiological and social habits, parties, athletics? Is there any way your data helps you to disentangle the two reasons why you might get infected?
No, I think the short answer to that is no. I think high school students are at higher risk, both because there's that population is higher risk and because they do more social stuff. I will say, question has come up a lot. I think that one thing to note about it is that little kids also tend to touch each other a lot, right? So kind of the high school students versus middle school students, maybe more about the sort of what are you doing and what kind of parties are you going to. There's obviously something age related, because little kids, like 2-year-olds, have a very hard time social distancing, and yet that does not seem to be a high risk group. So there's obviously both of these things going on. So the other, I think, big question is kind of looking at these is just to what extent are these infections being spread in schools? This is actually a very important distinction when we talk about this. There's a lot of, when we talk about COVID in schools, the place that everyone goes is to say, okay, well, they got when I say there's COVID in the school, what we think is you got it at the school, people are getting it at the school. And that may be true. But then when we sort of go and talk to places that are doing contact tracing, they basically say they don't think that people are getting it at the school. Another way to see that potentially is here. So this is the distribution of cases. Sorry, this is the first graphs got made nicer, and this graph got made this morning on Excel. So this is in the New York data, which is the sort of most consistent set of data we have. This is the distribution of cases numbers by school. So about 80% of schools have no cases. Of the schools that have positive cases, about 65% of the places with positive cases have one case, and about 25% have two cases. So a one case, like if you sort of think about like one case, it's, of course, people could have gotten that at school from somebody whose case was undetected, but it doesn't look like one case we would not typically define as a cluster. And, yes, there is one place with 10 cases, which, is probably something we would want to look into. And there's, one place with 4, 5, 6, 7, 8. Right? So there's a small number of places with larger cases, but most places have 1 or 2 cases, which is consistent really with kind of infection rates happening outside and kind of coming to the school as opposed to being spread at school, at least in a sort of broad sense.
Can I ask you something? So the data is all publicly available to anybody, or is it, or how?
So on the dashboard, you can download 2 things. So the New York data, you can just download publicly because we just scrape that from a public source. So you can download that all and like do your own stuff with it. The dashboard data, the identification is not publicly identified. That was one of the things that we committed to the schools that enrolled. There is an Excel where you can download effectively what you could scrape from the dashboard filters themselves. So if you kind of did all of the filters and you pulled all the things out, you could scrape out something. And so we've kind of provided that in an Excel sheet. You could also on the back end do some stuff in something called Stats IQ in the dashboard, but it's a little wonky.
So can I come back to the selection issue a little bit? What's the incentive for a school to provide you with the data? If I'm a very good outperformer, I would like to report it, otherwise not.
Right.
Do you have any incentives, and do you have any ways to correct for this selection bias?
Yeah, so I think there's sort of two answers to that. So what is the incentive? I think that, the big incentive for places to do this is because they want to be like nice. It's not a great incentive. As an economist, I'm surprised at how many people are willing to do it, like for public good purposes. I think that schools and districts are really struggling and would like answers. And so there's a kind of like I want to participate because I want other people to participate because I am like desperate to know what to do. We are going to provide out some district level reporting, which will be a sort of carrot for districts to be involved, where they will get some of their own kind of like private dashboard to be able to help them make some decisions. The biggest, honestly, like our current push, which I'm hoping will be the best way we can to address some of the selection, is to try to do more of what we did in New York and enroll whole states. So one of the things that has happened as a result of like people paying some attention to this is that states have come and said, okay, like what can we do to like get our data into this? And so we have had more support doing that. And I think if we can, pull in a few more states and and pull in all the schools in the state, then we will have a much better way we'll have a much less selection in the data. I will say that the data, so this is the New York data and this is the national version of this data, actually looks quite similar. This is like all the other dashboard information. It looks quite similar to New York.
Just one clarification question. These are distributions of cases in New York. Does it refer to schools or districts?
Schools.
Okay.
Yeah.
And so Rachel Fernandez is quite surprised that, because at school, students are together for many, many hours, while they're not, in a supermarket, that the numbers are so low. And the other question I would like to add, do you have any data on school buses as well? Does it make a difference whether kids go in a school bus together or not? Is there any evidence on that? Or do you collect the school bus, the transportation to school?
Yeah, so we don't have, so let me answer the second thing first, which is I don't have merged in here information on transit. I mean, I think that would be useful. I actually had a call the other day with the National Transportation, the National Lobbying Association for the School Bus Drivers, where we sort of talked to them about the dashboard and been talking to them about how we can pull in some information from them into this effort. So maybe that will be we'll see if that happens. On the first question, I think this is really the crux of this. People find this surprising. It is very hard to kids are together all the time. They're in school for the whole day. How is it how could it be that there isn't a lot of transmission in the schools? And I think that, you know, in some ways, when you look at contact tracing, that is done in general, the places that people are increasingly getting COVID are like unstructured experiences. So it isn't actually the grocery store much either. At this point, it's a lot of like backyard barbecues, parties, social gatherings. People take down their masks. You know, they drink. You know, they're at their kids' sporting event. They're sitting next to each other on the bleachers. You know, it's kind of hot. You take your mask off. You're drinking. And I think that has turned out to be a major source of current spread. And then you see, and it's, you know, so like, for example, I spend a lot of time now on the phone with places, with districts and places with a lot of COVID, because we're trying to understand, like, what are they seeing? So, you know, I talked to people from North Dakota. So I just want to be clear, like in this polling question at the beginning, are school reopenings positively or negatively correlated? It's actually a very poorly posed question, but what I meant was, are more schools open in high prevalence areas than low prevalence areas? The answer is, like, they're more likely to be open in high prevalence areas. So the places with open schools are places with a lot of COVID. And it doesn't seem like schools are driving the COVID, it's that the COVID is around and also the schools are open. So you talk to these guys in North Dakota about like what's going on. And they basically say, you know, they will tell me like I think things at our school are going great. You know, last week, like in the last couple of weeks, you know, we did have like 45 kids with COVID, but you know, they didn't get it here. We're like up on our contact tracing. They didn't get it here. You know, a lot of them got it. Like, we canceled homecoming, but unfortunately, a lot of parents had homecoming parties because of how we canceled homecoming, and a bunch of kids got it at the homecoming party. So I think, you know, places are having a hard time controlling. We're having a hard time controlling what people are doing outside of these structured environments. But inside the structured environments, it's much easier to have people mask and, you know, wash their hands and sit a little bit further apart.
Another question is, you know, there are all these tracing apps and all the high school kids in particular, they have, of course, smartphones. Have you ever thought of integrating something with some company in Silicon Valley who is using some tracing apps or is promoting tracing apps, targeting high school students or even, you know, younger kids?
In general, I think these tracing apps, these contact tracing apps, have not turned out to be what people had hoped. Because they're really sensitive. So like we talked about this in universities when we sort of started, and I was running this for Brown. We started talking about this in the spring. There was like so much like, we're going to have an app. It's going to Bluetooth you next to everything. It's going to be so integrated. It's going to be so great. But then it turned out those things are just really, really sensitive. And then it's like, how do you know, were you really next to the person? Like, we're going to be kind of quarantining everybody. And so everyone sort of moved to just like more general kind of contact tracing discussions. Yeah. Okay,
I'll let you talk.
Yeah, so I was gonna sort of like sum a little bit and say kind of like, what do I think that we, you know, what do I sort of take away from this, I guess. And I, you know, other than that, we just need to keep pushing to get better data, and maybe if there's a new administration, they will do more here, knock on wood. But you know, I think that that when we look at schools, our data is a piece of this. There's a lot of data now, and I think most of it suggests that what is going on is that schools are affecting their communities. Sorry, schools are not affecting their communities. Schools are being affected by their communities. They're reflecting their communities, but that there isn't a lot of transmission in school. And so that's consistent with what we see, but it's also consistent with, like, for example, in Rhode Island, we've got data on kids who are in school and kids who have chosen to learn virtually, and the rates are higher in the virtual learners than in the in-person learners. You know, that of course, that means, like, that's not good. It's not like saying, oh, that's such a great news, but it does suggest there's not a lot of spread in the schools. In the US, we've taken a sort of, in Europe, they've taken an approach that's like, schools are important. And if we are going to we should have schools open, even if we have other things closed. We haven't really taken that approach here. We've taken sort of the opposite approach. And I think that is, for me, that is the most frustrating, to be frank. The most frustrating aspect of this is to say, basically, look, the data suggests schools are not themselves major contributors to spread. Not that nobody's ever gotten it at school, but that this is not a major source of spread. which means that schools should be open. And also schools are important. I mean, thinking back to that Zern picture, like distance learning is not great for everybody, like school is important. And those combination of those two things mean that like school should be among the first things that we open and the last things that we close. And what we're seeing in a lot of places is that schools are kind of the first things we close and the last things we open. That's not true everywhere, but that's been a little bit of the pattern. I think in my view, we need to figure out a little bit of a way to kind of collect enough information and to learn enough that we can shift the conversation a little bit to say kind of where should schools fall in our ranking. Like if our view is like we're North Dakota and we're just gonna like let it ride and we're not gonna have a lot of COVID restrictions, I guess maybe we can have schools open with very high rates. And if your view is, everything needs to be really restricted, I think that's reasonable. That's also reasonable and internally consistent, but it should apply to everything, not just schools. The idea that we're going to have the gyms and we're going to have 50% capacity in indoor dining, we're going to have bars, but we're not going to have, schools for kindergartners. That seems to be sort of backward on both the benefits and the risks. So,
but why do you think is it so different between Europe and the US to, close the schools so easily? Is it mostly because teachers are more concerned here and they're reluctant to teach and they're very afraid to teach? I mean, when you talk to some of these schools, they'll tell you it's because our teachers don't want to do it.
Yeah, I mean, I think that there's clearly some union stuff going on in the US. I think that I don't know. I'm not really sure. I mean, it's just for whatever reason, Europe has, from the beginning of the pandemic, I mean, they did close some schools, but sort of that opening has been a priority, and we have seen schools continue to stay open even as like many other things have closed, and that hasn't happened here.
But do you think your analysis will help to convince the teachers that the risk is not so high to open the schools? That's the main message from your dashboard so far?
I think that's a message. I think that it is important to, I don't know that it will help convince them, but I think it is a message we need, it is part of a message to send. I think that there is a piece of this where there's just a lot of fear. And people are, there's a lot of fear. I think there are other really practical issues with school reopens in the US that have kind of gotten in the way even in places that are reopening. So when I talk to superintendents in places that are open, their big problems are kind of staffing shortages and the fact that they have to quarantine all their kids, right? So, you talk to these guys in Ohio and they say basically like, we're having a really good experience with case rates, which are very low, but we've quarantined, 1,000 kids because of like they were sitting next to somebody. And, by the way, only 6 of those people actually ended up with COVID, but they were out for all of these weeks. And like, we're struggling with sort of like the fairness of that and the kind of how do we teach them. And so I think those logistics have been really tricky.
Is it possible? So let me just make it a little bit black and white, that, kids don't get COVID in school, but they get COVID when they party and hang out together later on. Is there any evidence saying, when kids go to school, then they hang out more with each other or they hang out less with each other? So is there a correlation between going to school and having private parties? Is it positive or negative? Because it would be an indirect effect essentially from opening or closing schools, how to affect the private parties and the courts.
Yeah, I think for that, I think we would need to see more of this kind of data out of like that we're seeing on Rhode Island, where like you basically have the virtual kids and the in-person kids. And because I think that's the question is kind of like, what are people doing? We have this image that like, if you're not at school, you're just sitting in your house and not seeing anyone else, but that's not right. That's not what's actually going on. Kids are like, high school kids are off at, they're working, they're like seeing their friends. Elementary school kids are doing other stuff. They're exposed to their parents. So I think that's the kind of data we would need, but I don't know that we have too much of that. Yeah. That's what I had to say.
So what's the plan of the project if you envision it the next 3 months? So is it like collecting more data, getting the adverse selection issue?
Yeah, so I think we're working, I think our big project over the next, few weeks is to keep pushing to enroll states. So we're working with a lot of states to figure out like, what are the ways we can bring in the data that they have. There's a lot of variation in state capacity across different locations in sort of whether they have this. And I think, ranging from places like New York, where kind of like everything is all up, or Texas has also got kind of a pretty elaborate infrastructure at this point, to places that are like, we have no, like, the way that we are trying to figure out whether somebody at a school had COVID is I'm like reading the case report of that and looking for names of schools. So that's that's the range. So we're sort of working with places to say, can we help you? Can we like set this up for you? And then we can feed it back for you if this is the only way you would have to get this kind of information. Or, if you're already posting it, can we pull it? Can we pull I think the big challenge is pulling the in-person counts. So actually there are a bunch of places which have like just number of COVID cases kind of posted either by school or by district, but they rarely are reporting in denominators. I think our big pitch to this and pitch on this at the beginning was that we really need to understand how many people are in school. A lot of the early report out on this was, here are a bunch of cases associated with schools, but we have no idea how many people are at schools. And actually some of these cases are, people affiliated with schools, but the school was not in session, or, they haven't been near a school ever.
And do you have a sense, to the extent there is reporting to the official sector, is very different from state to state, or is there some harmonization going on to get a common statistical framework across the United States?
No, there's nothing, no, everybody's on their own. In fact, it's down to like, it's down to counties or even school districts, right? So a lot of school districts have their own dashboards. They'll have like the state didn't do a dashboard, so they made their own school dashboard. So there's just like no sort of harmonization of reporting. There's no harmonization of guidelines either. So this is the other piece that I think schools and districts have found really frustrating, is they want to know, and part of this is, we're missing information, but part of it is just there hasn't been a kind of, like people haven't been told, what should you do if there's a case? So like, you said that your kid's school, like when there was a case, it closed for 2 weeks. So in my kid's school, when there's a case, they contact the close contacts, and then they just don't do anything else. And I think if they had many cases, then they would, try to figure out what was going on. But for a single case, I think even 2 cases, they wouldn't do anything. But most school districts are having to make up those policies on their own without guidelines from the state about like what they should do. What do you do if a teacher has it? Should I have pods? Who should wear masks? Is the other thing that's come up, like little kids don't like to wear, like people don't like the idea that little kids would wear masks. And in most of these European settings, no masks for kids, right? So European schools are open. You said they have the windows open. They're really into like ventilation. That's great, but they don't have the masking. In the US, it's become a thing. Like basically everyone is, like in Rhode Island, everybody like 3 and up is masked at school all the time. Then in Texas, they're telling me, well, people don't want to come back to school because they don't want their 5-year-old to be masked. So we need to know if 5-year-olds need to be masked, because otherwise we can't get people back to school. So
let me ask, when Raj Chetty presented his initiative on using, private data from private companies, he relied a lot on tech companies. Is there something where you can collaborate or rely on some tech companies? So I can see the tech companies collecting a lot of data about online teaching. So you go from the kids who don't go to school, there must be some data out there, to how many kids are using online teaching. And then you can back out from the complement, how many kids are actually in school. Is there any way you can collaborate with some of the Silicon Valley tech companies and they have some data we don't know yet?
So we've talked, so Raj has got, so the Zern data, John and I have talked about, so John is my colleague. So John and I have talked about whether, we can think about merging that kind of thing in. But, again, like this sort of fragmentation of the US educational system relates to your question. So you have in your mind, like there's an online learning platform. Every school district in America has their own online learning platform now, right? So it's like this place, it's like actually like, Josephine and Sophia are the online learning coordinators, and like they teach the 4th grade online learners, distance learners, whatever curriculum the school district has made up. So some pieces of it are more organized. There are states where there's like a virtual academy, and the virtual kids are in the virtual academy. That's not actually that common. So we've sort of talked to a bunch of tech companies about this, but like there's no, like the information on this lives at the district.
Yeah. But perhaps Zoom has all the data. Because
Zoom,
the company Zoom, Because a lot
no,
of the
you know, it's not, no, forget it. It's like, you got to go for like, it's like seesaw. I mean, it's true. We could call it like, you know, there's seesaw and the this thing and then that thing and the, you know, this different random stuff. But again, like exactly how many kids are in person, it's just like a really hard thing.
Okay, great. Thanks a lot, Emily. I know you have some other appointment at 1:30. We have 2 minutes left. So typically, we learned a lot, and I think you will open up the data and collect more data as you come along. I think it's very important to get a systematic perspective on this, so we can actually bring the kids back to school. And I agree with you. It's very important for the children to get the social interaction. It's really very hard for them not to be at school for so long.
Yeah, and I think that's a point. I sort of like, I think we spend a lot of time in talking about the benefits, sort of focusing on like the kind of plight of low-income kids who have no, you know, the 7-year-old who's home by themselves trying to Zoom because their parents are at work, and that's obviously like the sort of extreme form of what is so problematic about the kind of in-person school. But then there's just the second piece, which is even if you're a person with like a lot of resources and your kid, you know, it's actually not great for people's mental health or physical health or other things, development to kind of be home. And that's true for little kids, but it's also true for older kids. And we're seeing that in sort of anxiety and depression cropping up a lot more than usual.
Let me throw in one more question. It seems from casual observation that private schools open up much more than public schools. And do you think this actually makes it, you know, for wealthy individuals much easier to handle the crisis than for less wealthy individuals? Do you think there's a distortion there? And why is it the case that public schools can't open up like the private schools? And then we typically end up at a positive note. If we can give some positive spin to the current circumstances on schools, we can end with a positive note just to add more positivity in the current environment.
All right. So I think, you know, I think it is true that more privates and like a lot of archdiocese, actually that's in some ways a better comparison, because, you know, like people would say, well, the private schools were able to open because, you know, they have more resources and they could do more things. And that's certainly been true. That change has exacerbated the kind of baseline inequality that we already have associated with, you know, private versus public school. A notable feature is a lot of the Catholics have also opened in person, including in places where things are not open. So like in Chicago, I think the Archdiocese is open. Even though the public schools are not. And I think that again, there's a sort of inequality piece of that. I think that the plus though, I would say, and so I'll end on this positive note, is that, you know, the kind of odd choices that have been made about reopening are an opportunity to learn. So if you sort of think about what would make it really hard to learn here is if everybody, like, it would be good in some ways, but very difficult in others, is if everybody was using science. And people were like, I'm only going to open if you know, the following case rate is this and the positivity rate is this. And so we saw the only places that were open were less than 3%, and the places that were closed were bigger than 3%. That might be it could be good or not from a public health standpoint, but it would be difficult to learn from. What has happened here is, you know, you have the places with the 20% positivity rate open. You have some places with, you know, in Maine with low positivity rate open. You got the Catholics open in the place where the districts are not. You got the private schools open. So there's like a lot of variation that we can potentially learn from. And I think that will hopefully ultimately be valuable.
Great. Thanks a lot, Emily. It's great that you're collecting this data, and hopefully many people will sift over the data and give us a lot of lessons to manage the crisis better.
I hope so.
Thanks again, and hope to see you soon in the real world after COVID.
Yes, indeed. Okay. Thank you.
Bye-bye. Thanks a lot. Bye-bye.